So if you did go to your doctor and your A1C is 6.5, it means that 6.5% of your red blood cells have been saturated with sugar, and that's the diagnosis. But the problem is this: type 2 diabetes starts with insulin resistance. So once the resistance starts, we start damaging every part of the body. So sometimes clinically, you may not be diagnosed with type 2 diabetes, but you may be suffering the damage of diabetes. And that is what is affecting just about every type 2 diabetic. So insulin resistance can persist for about 10 to 15 years before you see your diagnosis of prediabetes and diabetes, type 2 diabetes for that matter. So you will see the damages of glycosylation even without diagnosis. Your A1C may be fine, but the damage will be there. How do you determine that? Usually when you have your fasting glucose of over 100, it's a sign, it's a clue that there is insulin resistance and there is damage occurring. We have to understand this so that we can move away from what we see as far as comorbidities with type 2 diabetes. So if you are type 2 diabetic, you have to eliminate carbohydrates. There's no ifs and buts about it, as I did mention. We need to get away from it. That is why we need to come low on the carbohydrates. You can go keto, we can go carnivore. We just have to eliminate carbohydrates. No carbohydrate, no type 2 diabetes. And it's as simple as that. Because we have been conscientized to believe that we have to eat the complex carbohydrates, we have to eat this. But really, as you keep doing that, you are damaging your body. The research is very clear that anytime our postprandial numbers, that means the sugar, the blood sugar after 1 hour or 2 hours that we have eaten goes beyond 140, it starts damaging the organs. Must we wait until we have an A1C of 6.5 before we start treating these guys? No, absolutely not. So your fasting insulin is even a clue to tell you that you are suffering the consequences of high blood glucose. The average fasting blood glucose in the morning should be between 60 and 85. That is just the range. Anything beyond that can be a problem. The most you can go is 90 milligram per deciliter, and that is what we have to remember, and that's what we have to know. And if you are looking to really optimize your health, if you are really looking to fix your health, that is the approach you have to take. And it's as simple as that. Endocrinologists give you the pills, will give you the recommendations that will further worsen things. I've seen people do oatmeal for breakfast, brown rice for lunch for years of being type 2 diabetics, and they are on 3 medications. And sooner or later, you realize that they have a kidney dysfunction, they have erectile dysfunction, they have retinopathy, they have nerve damage. Yes, when you have type 2 diabetes, your damage is dependent on what